Hi, Nurse Amy here from Doom and Bloom. Just going to show you a first aid kit today. This is actually my first aid medium kit, or also known as my medium survival trauma kit. It actually comes in a really nice bag. This has a lot of great features. First of all, it has the clip in the front, and it's a trifold. So what happens is you have 3 sections. These would be filled with supplies. You have one in the front, you have one in the middle, and then you have a much larger section in the back. Now this is military grade, mil-spec canvas. It's water resistant. I don't want to say waterproof, but it does have a lining inside that unless you literally submerge this bag, anything that's rain or wet is just going to kind of roll off of it. It's got that flap on the top. In the back, you see it has some MOLLE, so you can't attach it to another bag. It has a handle for easy carrying and also a shoulder strap, which is adjustable. And you know, you might see some pictures on my website where I have it slung over me and sort of in the back, which is great for when you're hiking. So this is filled with a lot of great information and supplies. I do want to show you some of the first aid information in the kit, which is handy. It's nice to have a CPR AED and basic first aid little booklet. Now these booklets are great. It's going to basically tell you how to use all of this. What it doesn't tell you how to do, for the most part, is how to stop bleeding. And so what I've done is I've created waterproof instructions. And this paper is great because, again, if it's raining outside, you don't want to be looking at this and suddenly everything start bleeding, literally bleeding. The words bleeding, the images bleeding. These are great because it has the item that you're going to use, it tells you the actions, and then it has a picture of the action. So even if you can't read or you don't have your glasses on, you're seeing what you're using and what you're doing with it. So it goes through how to stop bleeding really quickly. Each of the tourniquets that are in here, because you will get 2, has its own instruction sheet. So this one's specific for the SWAT tourniquet, but you also have, depending on which tourniquet you select, one for the cat tourniquet, there's one for the SAM XT, and then there's another one for the soft T. So you do get a choice of 3 different tourniquets. So let's start from personal protection. Of course, you have nitrile gloves. These are important because there's a lot of people nowadays that have allergies to latex. So you want to stay away from anything that has a lot of latex. You don't want to cause harm to your patient. So first thing you're going to do is you're going to get those gloves. They are in the front pocket, easy to get to. You have a set of masks. I have always had masks in my kit. Never knew that they were going to actually be something that everyone has used at one point or another in the past 2 or 3 years. So you do have 10 of these masks, not necessarily because you're worried about COVID, but when you're taking care of somebody's open wound, you don't want to be breathing into it. You want to prevent future infections. So you want to put this on for the safety of the patient that you're taking care of. Now, if you do run into somebody who seems like they've got some crazy respiratory infection, you don't know what it is, if you want to ask them to put a mask on and then you to put a mask on, maybe you can, decrease the exchange of aerosol particles and maybe prevent, exchanging the infection that one of you or the other one has. So those are personal protection. Also in the front, we have simple things like honey. You say, now why in the heck would you have honey in a first aid kit? Well, it's great because first of all, it has no expiration date. Second of all, this is great. Someone has low blood sugar, and believe it or not, this is an amazing treatment for wounds. They've even shown that in some staph-resistant infections that this can take care of it, and those are called MRSA. So honey has a great low pH. It helps to prevent bacteria, helps to prevent infections. So I would almost use it interchangeably, or maybe in addition to, or instead of Neosporin or a triple antibiotic. So this has its advantages. There are people who are actually sensitive to triple antibiotics. So again, this is a no harm, no foul use. Again, another thing that's really wonderful to use honey on is burns. So you've got cuts, lacerations, you've got burns, rashes are really good. Anything that you want to prevent infection or to help protect the wound. All right, so great thing there. That's in the front packet again. And let's talk about some of the little wipes and ointments we have. Of course, we have antiseptics, like we have BZK, we have alcohol, we have betadine, but we also have oral pain relief gel. If anyone's been out and about and suddenly you get a tooth pain, it can be miserable. So I want to give you something that you can at least treat the pain until you can get to some place where it can be taken care of. So the patient doesn't suffer too much. There is burn gel in here, so just like the honey, we have actual burn gel treatments. It does have a little lidocaine in it, so if it's a particularly bad burn that does hurt a lot, these burn gels have that lidocaine in it. We do have an insect repellent. If you're out camping or you've gone on an adventure and suddenly you're starting to get swarmed with insects, we do have some insect repellent. And so, you can help prevent bites. But if you do get bitten, we have sting relief pads. Again, these, have some lidocaine in it, which is important to help relieve the itching because those can be bad. And of course, the more you scratch, the more chance of an infection. So we want to prevent all of that. So use your sting relief if someone gets a bite. If you have someone who is in discomfort, we do include ibuprofen. There are 2 tablets of 200 milligrams in each one of these packets. Dose it out as you judge the patient's weight or how much pain they're in. You can use up to 4 tablets every 8 hours. That is equal to a prescription dose of ibuprofen, so you can go up to that. If it's very mild, you can just give one and kind of not give too many based on their pain level. If someone has a back irritation, they walk too much, they hike too much, their back's just killing them, we do have a patch, because if you're out and about and you need to get back where you're going, you may need to have something, again, for some pain relief. We also have Gold Bond. These are great for possibly stopping a blister in your foot or chafing in other areas, maybe under the armpits or other areas. It's also great if you have a hot area. So let's say you've started to get a blister. So you take your socks off, wash your feet, dry them real well, put some of this Gold Bond on, and then put your socks back on. It might actually help to prevent a further worsening of the irritated area that was going to become a blister. So that's really good. We talked about antibiotic ointment. I don't use the triple antibiotic because, again, more people have sensitivities to that. But I use the bacitracin, and that has zinc in it, which again is very healing. So this will be good for your little scratches and your cuts. Of course, after you wash them thoroughly and after you put an antiseptic on, then you want to do your bacitracin. To cover simple little scratches and cuts, we have Band-Aids, and these are, again, hypoallergenic. We don't want to introduce any allergies to patients, so we have a lot of different sizes: big, large, small, rectangle, circle, so lots of Band-Aids. If your wound requires a little more care, like maybe it's open a little more, you can use super glue. Now, super glue is not going inside the wound. I think people misunderstand what you're doing with super glue. It's really a barrier on top. So what you're doing is you're going to pull the wound edges together, hold them together, and then you'll put a layer of super glue, let that dry, a second layer, let it dry, and a third layer. Now, what you don't want to do on top of super glue is put on an ointment. So this can break down your super glue. So once you've sealed it, because you've washed it already and put an antiseptic on, this is sealing it so it shouldn't get an infection. So that's an option to seal wounds. Again, not inside. If it's a little further apart, let's say, the wound has just got like a little edge just sort of gaping, super glue is not going to hold it together. Well, we have steri strips. Steri strips are wonderful. They're little pieces of tape. You start on one end of the wound, pull it. You want to put the pieces of the edges of the wound back together nicely to make sure they're not overlapping. That's not good. Put them together, put a few tapes on, To make the tape stick better, you can use something called benzoin. Tincture of benzoin. It's sticky, it has a little bit of a smell to it. These are in the glass swab, so you're gonna break the glass swab, it'll come up to the cotton, and then you're gonna do on the outer edges of the wound. This is not something to go in. This is strictly an adhesive, sticky, tacky solution that's going to help hold these steri strips on for a longer period of time, because these can come off after a day or so, or even if you wash your hands too many or wash your area too much. So the benzoin helps that. In cases of remote areas, you're not getting back to modern medicine anytime soon. You cannot suture if you do not have a medical degree, and society is in existence. So don't go suturing your friend just because you're on the top of a mountain. You can't do it without a license. So don't do that. If society's broken down, there's no place for you to go and you don't have a choice, then you can suture if you have the skill. So we do have that, and we also have some curved clamps. You're going to want to sterilize these with your alcohol. Boil these in water for a few minutes. You know, get this as clean as possible. Use your clean gloves and try not to touch the inside of the wound or the string that you're suturing with too much. So you want to keep this very sterile. You do have that option. Some other instruments we have, of course, and I showed you this on the instructions. We have handy dandy bandage scissors. I like these better. You can sharpen them, you can also tighten them up. It has a screw. A lot of your cheaper EMT scissors, you can't do that. The more expensive ones you can. We have some clamps, but again I showed you the curved clamps. We have some iris scissors. You can cut things with that, and we have tweezers in case someone has splinters or you need to pick debris out of a wound. Some other examining things we have tongue depressors. That's so you can look in the mouth. We have a pen light. I usually put the batteries in backwards in these, so if you get one and you say, oh my gosh, it's not working, take it apart and change the batteries, because I have done that on purpose so I don't ruin your batteries. Also a flashlight. If it's at night and you can't really see what's going on, a flashlight's handy. We have a thermometer. I have a scalpel in case you need to possibly open up an abscess and need some drainage. Another lighting option we have is an emergency light. This is a 6-inch. It's a 12-hour glow light. You can use it to signal for help or to see what the heck is going on and give yourself some lighting. I'm not sure we talked about the hand sanitizer, but this is something really important. Before you handle instruments, before you get near a wound, you need to alcohol your hands or hand sanitize your hands, and always put gloves on. These are super important. Again, you're trying to prevent infection. I do give you a 60 cc syringe. Cleaning wounds. You want to wash wounds really, really thoroughly. If you don't have running water, you need to get a jet of water going into the wound. The best water to use is potable. So if you know you've made it safe for drinking, it's fine to use for cleaning wounds, and the 60 cc syringe gives you a nice jet, and so it really, really washes out the wound super well. Don't be afraid to clean and clean and clean and clean. You can never over clean a wound, honestly, and make sure if there's debris, you're picking it out, you're scrubbing it if you can. You want to clean a wound as well as possible. It's all about prevention of infection. The next thing I have in the next section is for bleeding, and then again it refers to the instructions we gave you. So of course you would have some gauze to put on the wound to help. First thing you want to do is to try and put some pressure on it. If that's not working, you're moving on to your tourniquet. You have two choices. You may have to use both of them. This is best for smaller people, even pets, really skinny people, babies, small children, anybody who's super thin. Sometimes the cat tourniquet or the other options of the Sam XT, the Soft T, or I also have orange ones of the cat tourniquet. You have an option also of a black Soft T, but sometimes these military size tourniquets are not appropriate for really, really thin, emaciated, tiny children or even pets. they're just not going to give you that really good secure tightness that you need to stop bleeding. So you may have to use the swat. And also, if you've used this tourniquet, the military tourniquet, and you start rebleeding, you may have to add a second tourniquet. So it's nice to have two of them. I really do like to give you both of them just in case. You put the tourniquet on, you would fill the wound up with some gauze. We have some roller gauze in here. Stuff the wound really, really well. And then maybe that's stop the bleeding. If not, you may have to pack it with some hemostatic gauze. You're going to remove the regular gauze and then put this in. Lots of pressure. You need to hold these in for at least 3 minutes. Two options that I have are Quick Clot and also Chitosam. Both of these are equally effective. It just depends on what you were taught with, what you've learned, what you prefer. I don't care. I personally use this one more often when I have some bleeding, only because I like the consistency of it. It's a little thicker. It's almost like I want to say a diaper material, and I get a lot more, I think, for my buck. And I can cut little pieces, and if you have like a nosebleed, you can just tear off a little piece and use it. Anyway, I use this one, but honestly, I don't care. So whatever you prefer, they work. It's your choice. In this kit, you pick one. This is a little more expensive, so it would be an upgrade. This comes standard, the Chitosam. So, and by the way, this is made by the people who make SAM splints. So if you have heard of SAM splints, those are made by the same company. And yes, the guy is actually named Sam. And we do have, speaking of SAM splints, an instruction guide. So it tells you how to apply your splints wherever you may have an issue. So you do have, let's go to orthopedic, you do have a 36-inch SAM splint. You also have a finger size SAM splint. You have a ice pack instant. We also have a reusable that can be used for heat or cold. We have ACE bandages to hold those SAM splints on, or just to wrap a sore knee or a sprained ankle. So we give you two of them. We talked earlier about blisters. We also give you moleskin. So if you've got a beginning of a blister, you can cut a little circle, put a hole in the middle, because that's where the blister goes. The padding goes around the outside of the blister. Put a lot of padding over that. You may want to put even, I know it sounds strange, but even like an iPad over the blister and then tape that all down. You can use a couple of big Band-Aids over it also, but really what you want to do is get as much padding on it before you put your sock back on and your shoes if you've got to keep hiking. Of course, the best thing to do is to wash your feet, dry them, and keep them out of shoes and keep them from rubbing in that same spot. That's your true prevention. Another thing to hold gauze on, or to wrap any kind of wound covering on, is something called a Coban. This is a self-adhesive, sticky type ACE wrap. So instead of having to fasten this at the end, you can cut off a piece and cover your gauze, or cover or wrap your SAM splint. You don't have to use the whole thing. So this has a lot of uses, and I really like to include this because it's versatile. We do have a CPR mask in here. I know a lot of people are not being told to do the breathing, but if you are a medical professional and this is something that you've learned and you want to protect yourself, I always include a CPR mask. I think it's super important to have, because if you've got two people or you feel like you really need to do the breaths, you know, that's how you're taught. Do what you're taught. It's better to do what you were taught than to forget the new stuff and then do it all wrong. So if you want to do the breaths, that's fine. We have Mylar blankets in here. There's two of them. They're pretty large. This is something you would put on if you wanted to keep someone warm, if you wanted to use it for signaling. Also, after you've stopped bleeding, you definitely want to help prevent shock. So if somebody's had some traumatic situation or traumatic wound, you want to cover them. But always lift it up and look at the wound, because when we talked about that rebleeding, that can happen despite all of your best efforts to, you know, put the tourniquet on, put the blood stopper in, and also wrapping it up with an Israeli bandage, which we didn't talk about yet. We'll talk about that in a second. You're going to cover up, but that prevents you from seeing the wound. So make sure you're lifting these up to reevaluate the patient. Oh, let's mention the Israeli bandage, or also known as the emergency bandage. This is really great. This is exactly what the military has been carrying for years. Different packaging. It's been kind of an OD green for a while. I think they're making it now in a black package also, but it's the same exact thing inside. Comes in a 4-inch, comes in a 6-inch. I do put a 6-inch in here. So basically what this is a big thick pad, an ABD pad inside here, again sterile, attached to an elastic type wrap. So imagine this stuck onto a big ABD pad. When you open this up, you're going to place the ABD pad, the sterile side down, onto the wound. If you're covering a burn, it may be helpful to put a non-adherent pad underneath it. But what you can do is cover up the bleeding wound that you've stopped with hemostatic gauze, and you're going to cover that. The wrap will go round and round and round. At the end is a clip. The clip will attach to a portion of the elastic wrap. You can attach it on the top and the bottom of one of your wraps, or 2 rounds of your wraps. You can also slip it underneath some of that wrap material and twist it as if it's a tourniquet to create more pressure. So just like you have your windlass on your tourniquet that you turn, you can use that over here. It's not as effective as a military style tourniquet or even a SWAT tourniquet, but it does apply pressure. It's really versatile. You can also use it to hold on SAM splint material. You can use it to hold on any of your gauze, your wound coverings. So it's really great for protecting wounds, keeping them from getting infected until you get to where you need to go. It also can work if you had used up your ACE wraps for some other thing. Because it has that stretchy material, you can use it to wrap an ankle, use it to wrap a knee up. You can even use it to make a sling, like we were using our triangular bandages. And it's super comfortable because it has a little bit of a give. It's not as stiff as the triangular bandage. So it is pretty comfortable. You can use it for that. So you can think of a lot of things to use this for, but this is something that's in the kit. This is the 6-inch. Again, I do sell the 4-inch separately if you wanted to add some extra stuff to your kit. We also have 2 triangular bandages. They have safety pins in them. This is great for slings. It also holds on the SAM splint, holds on gauze, can wrap an ankle, wrap a knee. Lots and lots of uses for triangular bandages. So we do put 2 of these in. Different kinds of tape. We have paper tape if someone's super sensitive. We have regular cloth tape. And of course, my favorite is duct tape. What can you not do if you have super glue and duct tape, right? 2 great combinations. That's how I grew up. My dad was a mechanic. Super glue and duct tape. Always got to have it. I do have a strange thing in here, but I think it's really handy. It's called the Chuck's pad. And if you guys have new puppies, a lot of people have heard, they call them puppy pads. But the truth is they've been around for a very, very long time in the hospital environment. They are for putting underneath patients who you need to do wound care on or need their bed protected because they might be incontinent. But the reason I put this in here is so you have a clean surface if you're out camping or you're outdoors, so you have someplace to lay all of these items, these supplies, so you can have them not on a dirty surface. So it's a clean surface for you. We have lots and lots of sterile gauze. We have 3, they're called ABD pads, they're 5x9. We have non-adherent. This is great for burns. This has got a little shiny side so it won't stick to a burn that's healing. You have what's called 4x4s. 4x4s just is the size of the gauze. There's 2 in each of these packs, so you have 12 of those. I did show you the roller gauze before, but these are sterile and they're 6-inch each, so you have 2 of those. You have iPads, 4 of those, and you have 5 of the 2x2. Again, it just means the size of the gauze here. And I think that I have, oh, let me tell you about your options. So, you know, we do have a bleeding trauma kit within this kit, but you have options. If you want to add a double set of chest seals, you have one for an entry wound and one for an exit wound. They're both exactly the same, doesn't matter how you put them on. There's instructions on here. So these instructions come with these 2 chest seals. You also have an option if you know how to use it, if you've been trained, for a 28 French nasal pharyngeal airway. Those are something that go through the nose into the airway. There is a lubricating jelly because you're supposed to lubricate the outside before you insert it. If you know how to use it, great. If you don't, it's probably not something you want to get, unless you're of the mindset that if I have it, somebody's injured and then there's another person who knows what they're doing, they're trained, I can give them the supplies, they can take care of the patient, done deal. So this is my medium survival trauma kit, also known as my first aid kit medium. They're both exactly the same. The reason they have different names is for FSA friendly. And I'm always sort of adding new things and tweaking things, and so this is my current. This has been pretty stable for a few years. I'm really happy with what's in it. So if you want to get my medium kit, please go to store.doomandbloom.net. This is Nurse Amy. Thank you so much for listening. I appreciate it.